are itching to answer your questions about allergies. Next, On Call with the Prairie Doc.
Good evening and welcome to On Call with the Prairie Doc. When we have an allergic reaction, it's because our immune system mistakes an otherwise harmless substance as an invader. The immune system overreacts to the allergen by producing antibodies. These antibodies travel to the cells that release histamine and other chemicals, causing an allergic reaction. And you correct me if I'm wrong on that. Allergies are among the most common chronic conditions worldwide, and the symptoms of allergies range from making us miserable to putting us at risk for life-threatening reactions. Many of you at home have allergies or certainly questions about them, so call in your questions regarding allergies to 1-888-376-6225 or send them to us as an email. To help tackle those questions tonight, I'm joined by two good friends of the show, Dr. Mark Bubak of Dakota Allergy and Asthma, and Dr. Tom Luzier of Aberdeen Asthma and Allergy. But first, Tom, you just had a terrible experience this week. Could you, tell us what happened.
Okay, this is going to be the quick part.
Quick story.
We came home from my mother-in-law's, and I went to walk the dogs. My wife yelled, "Our house is on fire." That's not something you want to hear.
This is last Friday night.
Friday night, and I yelled, "Oh no, there's something original."
Yeah.
So I ran into the house to see where the fire originated from, ran around looking for the typical things like I left the toaster on or something like that, and that was not the case. I ran up the stairs because we had one small dog that was up in our upper bedroom. We had, the other dogs had exited, and when I got up there, it was obvious I couldn't see, so I ran back downstairs to get a flashlight. By the time I went back upstairs, the smoke was even thicker, and again, I wasn't thinking of anything being on fire at this time. As I went to the bedroom, to my right was like looking into a campfire, and that was my bathroom, and it was on fire. And I was unable to rescue the little dog. I had to decide, because when I was down on the ground, I could feel the oxygen leaving, and that told me that that still small voice said, "You better get out of here." And so I did, and crawled back, and then I had to tell my wife that I was not going to be able to rescue the dog. So we got out of the house, and most of the dogs got out of the house, and then the house did. Fires have a personality if you talk to people who fight them, and the gases that formed eventually caused a tongue of flame to go the entire length of my house, incinerating the banister in the hallway that I was just in, blowing the windows out. Our rural fire department was absolutely amazing. They got there in 25 minutes. They have to go from their homes to the station to my house.
And a 20-minute drive to there. So that was
They were awesome. And they set up their swimming pool, and which is a great big, the pumper trucks dump into the swimming pool, and then the hoses pump out of there. And they were awesome. They really. And of course, they ran into the fire, and that's not a job I would do. It was so hot, they had to fight it from the outside first, which, if anybody wants to actually see the pictures, they're two very fine pictures on the Aberdeen American News for Friday and Saturday.
What a hats off to all firemen and women who are volunteers and are paid to do that type of a thing. It's a wonderful deal. What would you say is a take-home message? I mean, it was probably a fan, do you think?
It was the inspector came, and his best guess was a fan that was malfunctioned. So again, have fire alarms,
and we
have
always
a plan.
have those bathroom fans, but sometimes they get old and they squeak.
That would be bad, because if they can heat up, short out, and burn your house down.
So fans are a dangerous thing. I mean, a number of fans have burned a number of buildings in Brookings, I know for a fact, and so that's a take-home lesson. And then you came anyway.
Absolutely.
Thank you for joining us tonight.
Allergy is soothing to me.
It's rewarding.
Talking about it anyway.
Yeah, it brings you out of it. So this is an important show, and we want you to call in your questions, 1-888 376-6225. These are the allergist experts that we have. Mark, we know you well. You're from South Dakota, but you were a Mayo trained. You went to Sioux Falls and then went back to the Mayo. Anything that you want to share with us about your story?
The biggest thing is I love being in South Dakota, seeing allergy patients, and it's just great to be on your show and talk about allergy to people.
They wanted you back, and you loved South Dakota, and you left them. We appreciate you. And you're a pediatrician too, Tom, or
originally trained a pediatrician in the military, Fitzsimmons, which isn't there anymore, and did general peds for about 6 years, and then went back and did allergy training.
There are a lot of allergy symptoms this time of the year. What are the causes of the allergies?
Allergies in springtime are trees and mold, and boy, this year has really hit hard.
It has. So there's a lot of stuff happening. So pollen is doing it. What are the most important things to do, Tom, for pollen allergy right now?
Well, again, avoidance we always talk about, but nobody really likes to do that. That means close your windows, wear a mask when you're mowing and getting the thatch up from your lawn and that kind of thing. It's the right thing to do. It's not very practical. You know, your kids are on the playground, you're not going to put a mask on them, that kind of thing. Right. And these windy days, I mean, this is 40-mile-an-hour wind, really distributes the pollen and the mold.
I don't care how you do it. So what would be the classic symptoms of allergy right now?
Oh, terrible. Swollen, itchy, watery red eyes, the nose is all plugged up, and they're having sneezing fits, 10 in a row, just clear, runny stuff.
Okay, and the difference between a cold, Tom?
Mostly the itching and that histamine release kind of thing. And again, success of the medication. If you take an antihistamine or use a nasal steroid, it's going to be successful with allergy. It isn't with a cold. The allergy it continues for the whole season. A cold should be just 3 days.
Well, a cold starts with this ache all over, really sore throat, and then it moves into a hacky cough but longer than 3 days. But it's done in a week or two, and an allergy goes on and on.
Well, and then the allergy, the risk factor is developing an infection as a result of that swelling and obstruction and that kind of thing. And that's really what brings them to our stead, is that recurrent infection, having to be on antibiotic, that kind of thing.
Right. So the bottom line take home on this particular issue is there's antihistamines at work. What would they be, Mark?
Well, I think probably the idea of a non-sleepy antihistamine for quick, an hour later you're better, but if you've got a bad allergy season, those are going to not work well enough, and you're going to have to switch to nasal steroids.
So steroids and not Benadryl, but the long-acting non-sedating is your preference?
The Allegra, Zyrtec, Claritin would be the trade names, and they're all generic, and just buy the generics.
Buy the generics. Every year as spring progresses, we're told about the pollen count and its daily levels, but what is it and why should we care?
Pollen levels are the pollen concentration based on a specific location. Knowing the current pollen levels is a helpful tool for those suffering from allergies and hay fever. Pollen levels are directly affected by weather conditions. But what is a pollen count? A pollen count is the measurement of the number of grains of pollen in a cubic meter of air. Pollen counts and concentrations are generally taken using a sampling system called the rotorod, which uses silicone grease-coated clear rods that are exposed to the air on a set schedule, usually over a 24-hour sampling period. As the pollen number increases, people with allergies will have an increase in their allergic reaction. Pollen counts are measured from low, meaning they affect few individuals, to high, meaning symptoms affect most allergy sufferers. Typically, spring yields the highest pollen levels when plants, grasses, and trees are flowering, particularly in the early mornings. Warm, dry, and windy weather and climates with little or no rain have high pollen levels. Rain or cool weather dramatically drops allergy levels. However, many plants pollinate year-round, so you could experience allergy symptoms throughout the year.
welcome back, and thanks for questions. And 888-376-6225. Give us your calls. So we're talking about pollen count. And they just gave us the Brookings pollen count. What does that mean? How do I interpret it?
Well, this is, somebody actually uses that little tool to count.
Right.
And over the years, there's been a number of people that count. And currently in this area, Omaha is counting, Minneapolis is counting. I don't think anybody's... Sioux City is counting. So, because it's quite complex. I mean, it takes a lot of time out of your day. So it's not everybody wants to go and do that. But the bottom line is that they've taken the averages and they report those as the pollen count. And we know what the progression is by the temperature and that kind of thing. So those counts you see up there are the real deal. You are going to be symptomatic. And the pollen are those little brown catkins, because pollination takes place well before leaves are set.
Right, so, and what we're talking is leaves right now. I mean, this is tree pollen allergy season, and then it moves to grass and then moves to weeds, right? I mean, explain the timing on that, Mark.
The tree season starts at the end of March and goes on through April and into May, and at the end of May, they're done for most of them, and the grasses take off like crazy for June and July. And towards the end, the weeds start blasting off, but the grass keeps going, and when it freezes down to about 26, a week later, we don't have pollen, but we still have the mold when we don't have snow.
So the question is taking medication. We have a question about staying on medication all spring, summer. When should they be on their medicines? We talked about antihistamines, the non-sedating, way better than Benadryl. But the steroid nasal spray is probably better. When is the timing, and how long should they be on it?
Well, if you know you're allergic, you need to start it before the season, at least 2 weeks, because it's an extremely low dose. That's why it's over the counter. 50 micrograms. That's not very much. And so it takes a while for that to work. So it will not work for you if you say, oh man, I'm symptomatic. This is almost a preventive medicine over a rescue medicine.
Right, and is a prescription medicine more powerful?
No.
It's the same as the over-the-counter.
Yes.
So we might as well use the over-the-counter if it's cheaper.
Right. Sometimes they're going to sell the behind-the-counter Flonase before they make the transition to over-the-counter.
Yeah. So the Nasocort's just as good as the prescription kind. It's over-the-counter. Start it 2 weeks before your symptoms.
And take it all the way through the season until you know it's over with, and then you stop.
So now the question is, some people are spring allergy people because they're tree allergic, and some people are summer because they're grass, and then some people are the fall allergy. But a lot of us are, I don't know what the heck I am, I just know I get stuffy.
That'd be seasonal. All the season that it's it. Then there's perennial. Those are the people that have cats, dogs, mites, and mold. Mold being the only time it's not out there is when there's snow cover. And if you're ranching or farming, you're moving hay, you're doing a lot of things that are mold producing that are not associated with that.
So those are all year long. I mean, is it wrong to take these pills or take the Nasacort all the time? Side effects?
Actually, it's been around for 25 years, and people have got biopsies of the nose, and the Food and Drug Administration just said it was safe to take it long term.
Right.
There are, be careful with how you use it, and in doubt, have your doc check you.
So we got a question, how long does it take for common allergy medicines like Claritin or Zyrtec to take effect? I mean, and you said it, the nasal spray takes about 2 weeks, probably?
It takes about 3 days to kick in and maximizes at 2 weeks.
Absolutely.
Whereas the pills take about an hour, and that's about all the better you're going to get. So with the pills, you're as good as you are with your first dose.
Oh, really?
It doesn't accumulate. It's not something that's cumulative in its effect. You take it, that's what you're going to get.
But if I know that in the 1st of May I generally get sick, or really 1st of April I generally get sick, I should start the Claritin 2 weeks before, and no, just as you're starting to get the symptoms, start the Claritin.
Yep.
Right.
All right, so we have another question about how effective and safe are homemade saline nasal solutions in cleaning out nasal sprays. People talk about saline nasal sprays, That's over the counter, but they're really cheap. It kind of cleanses things. I like it better than hard nose blowing. Helps them clean out. You guys are excited about saline nasal spray? No.
Not really.
Well, I think I'm not in total agreement. I use a lot of it because I do think that it's kind of like taking a shower in your nose. And I do think it's valuable in that
to wash
respect.
out the dirt.
Yeah, we're talking agriculture here. This is South Dakota. I mean, and so I think it has benefit there. And salt water is somewhat bacteriostatic, so that is helpful. And then you have to be careful of what you use because there's hypoosmolar, meaning it's lower than there's normal, what we get out over the counter if we mix it properly, and then there's hyperosmolar.
Where you mix it improperly and then it's too salty.
Right.
So the right exact amount of salt, if you took a quart of water, would be like a teaspoon of salt, isn't it? It's not very much, is it? What's the right amount, you know?
I have to calculate it because it's an eighth of a teaspoon and 4 ounces of water.
Eighth of a teaspoon.
4 ounces of water.
So a full teaspoon in 16 ounces. So
go to the internet. It's calculated for you. Check it out.
All right.
Or use a commercial one.
All right. But no more than a teaspoon for a cup of water. That's
a teaspoon and a cup of water. Whoa, dude, that would be.
But you know,
that'd clean out your sinuses.
You can wash the pollen, the mold spores off, gets it off, and so it could be beneficial that way. But if you're going to squirt something up your nose, and you know the Flonase, the Nasacort, they've got a liquid in there that's also kind of cleansing. The solution all by itself does help. In addition to the vehicle helps also.
Is there ever? Okay, but there's another nasal spray. There's the Afrin and all of the 12-hour.
Oh, thank you for bringing that up.
Okay.
Don't use it. Afrin is a decongestant. Awesome. Yeah, and you can use it for 1 or 2 days if you can't sleep in that. But it has the effect, it has rebound. And that rebound means my nose is going to swell more when it wears off than it was swollen when you took care of it. So it is a two-edged sword. So it does say 3 days, and that's what you should stick with. Now, our ENT colleagues and us, we do use it a little more aggressively under certain circumstances, but let us guide you through that.
Yeah. And if you get into what is called medicamosum, or
rhinitis
medicamosum,
medicamentosa.
Medicamentosa.
Yes.
Then you do the steroids. I mean, that's, you know,
the steroid is still the right thing to do. So you have to go back to what you originally should have used in the first place. Yeah,
oh,
exactly.
Wow. What are the main causes of chest congestion? The caller doesn't think that congestion is caused by a cold. So chest congestion.
Yikes. I mean, there are a lot of things that cause chest congestion.
It goes on and on.
You're an internist, and you know that list is honey.
Yeah, it goes
from our perspective, it's rare that you get chest congestion with nothing in your upper airway. This is your first filter, so you're going to get something here, most likely before you get here, when it comes to allergic disease. Now, we follow another disease process called asthma, which allergy is a part of, but there's asthma that is not allergic. So chest
low-grade infection kind of a thing.
I mean, congestive heart failure.
It goes on and
on.
Right.
Bacterial pneumonias and so on and so forth.
That's why you need to see your primary care and let them kind of sort out why do you have chest congestion.
Right. There are people who have what is called chronic bronchitis, which is related oftentimes, most of the time, from smoking, not always. And they just have a low-grade, kind of a chronic inflammatory process in their lung, and they need asthma meds. They're bronchitis medicines for the most part.
Right. Well, they have that epithelium that moves the mucus and all that. That's all gone, the ciliated epithelium. So they have just loogies that they have to cough up because it doesn't work.
Right. What do you do for loogies that you have to cough up in chronic bronchitis?
There's a nice medical program that those folks need to be following, and big thing is stopping smoking.
Yeah, that's the big one. What are the main causes? Let's say late 70s with dry, hacking, wheezing cough with no cold. Should she go to a doctor, and could it be allergies?
Unlikely allergic again because it's primarily coming from her lung without any upper airway symptoms. Yes, she should see her physician because just what we talked about. Yeah. That is a long line of some things that are very important, particularly congestive heart failure and things like that.
Well, there you're referring to sending the patient to the primary care physician. How often do you send people back to primary care docs?
Always. Most of the time, at the end of the visit.
It's a cooperative effort. You don't just have an allergist, you don't just have your diabetic doctor. You need to have somebody that helps.
Somebody's got to
organize
all of that because there's, you know, you get to 6 or 7 medications, somebody better be taking care of that.
Right. A 50-year-old woman would like to discuss the advantages and disadvantages of AV-Q auto-injector. What's that, Mark?
Well, I happen to have one in my bag. These are epinephrine injectors that if you're having an anaphylactic reaction, all of a sudden you're going to be needing something to help reverse it. The AV-Q has a different size and shape than the EpiPen. Both of them deliver the exact same medicine. They're great if you have your throat swelling, your blood pressure's going down, you can't breathe because of your peanut allergy or the bee stung you, and it's whichever one you like best. This one actually talks to you, and for some folks they like that. This is what people have had for years and years.
What about just having because if you had no money, because these can be kind of spendy and you're not covered by, always covered by insurance. If you had an epinephrine bottle and a syringe, I mean, do people still do that? That works. And it could be cheaper.
Well,
the right dose is the question.
Well, people don't carry it with them. I mean, there are all kinds of studies that show that people who are armed with an EpiPen usually don't have the EpiPen where they need it. And so part of the design of the AV-Q was so you could carry it. It's expensive. This is kind of the standard, and if you remember to carry it and have it available, it really is very effective. And you need to have the people around you familiar with it because maybe you won't be able to
do it,
to use it when you have the anaphylaxis.
So teach your friends and family.
Yes, teach your family well.
Okay, but here's the other question. Well, I'm not quite sick enough to use it, and besides, you can have side effects, right? I mean, would you say it's fair to make the comment that if you think you might need it, you should use it?
You should have used it already.
Okay.
That's what I tell patients.
And what harm is it going to do?
Have you ever been gone boo at the theater? Your epinephrine gets going and you have a little shake. That's the side effect.
A little nervous. It's that same feeling. That feeling that when you're standing up to play a trumpet solo, that's the one that I got the most jittery, particularly when you don't know the solo very well. You know.
Yes.
That's a jittery.
Yep.
Patient was tested by skin scratch, excuse me, and it shows no allergies. However, he has itchy eyes and runny nose. Is it allergy?
Yes, it could still be allergy, but not likely because there's many causes of itchy eyes, including dry eye. If your eyes are dry and you get something in it, it's going to feel like there's sand in it.
Well, a lot of people don't have the juice.
Right, and then there's this wonderful process called vernal conjunctivitis, and that's an inflammatory conjunctiva, that's the inside of your eye, and it's not allergic. It happens mostly in the spring, and
vernal meaning?
It happens mostly in the spring, vernal, and we really don't understand the full mechanism because it does have some eosinophils in it, which are the cells associated with allergy, but it isn't allergic. And if you put drops, no, it does. Zaditor, which is an anti-inflammatory ketotifen, actually is pretty effective in that. And steroids work, but you don't want to put too much steroid in your eye because then it leads to cataract formation and glaucoma. So that's when you want your ophthalmologist to really take a look at it. But I've liked the effect of the Zaditor. And these people do have trouble with like mold and dust and a lot of particles in their eyes, welding. They're the kind of guy that is working street work and that kind of thing.
Any comment about what he said?
But the basic question, though, if you've got the right things tested for and you were negative, that helps us rule that out. but the runny nose, the dry eyes, there's a lot of non-allergic diseases, and well, sometimes you treat them very similarly to having allergies.
People who have a runny nose that's kind of chronic, there's an inflammatory process going on for some reason, it may not be allergic, the steroid is the right answer then.
Often that's what we use with nasal steroid. If that's not helpful, there's antihistamines and anticholinergic medicines to help dry up the drip.
Right. What is the youngest age that the allergist can do skin testing on children, and is it worthwhile to do blood testing on little children? Well, let's talk about skin testing versus blood testing for allergies, but let's first start with children. You're the pediatrician.
I'm the pediatrician. So the skin is so reactive in children, number one, that you really have to be skilled at reading them. And so when the child is under 6 months, I really listen to their history. And if their history is convincing, we do testing that is appropriate for that. So we might do 3 tests on it. Is the blood test helpful? Yes, it can be helpful. It also can be misleading because it's looking at circulating IgE, not IgE as it's active. That's the advantage of the biologic skin test, which is testing where the rubber meets the road, compared to the blood test, which is just about it's circulating around, but not necessarily doing any work.
Yeah, what do you think about the blood testing used commonly by non-allergists? I mean, the allergists seem to do the skin prick testing. It's better, is it not?
Actually, allergists use both. And some people's skin, or they have other diseases, and we can't test by skin test. Let's face it, the allergy skin test is more accurate, it picks things up better, and it's 1/3 the price. So you get your really good test for less money.
Okay. So it's a better test, less money, but there's times when
However,
you need it.
if I was sitting, I was the family doctor, and my patient had a cat, and they've got their asthma, and I wonder, could it be the cat that's making them a lot worse, or the dust mite? That's 2 tests to order. You don't need to order every food and every other thing for thousands of dollars. Just order the 2.
Do the blood test for the cat and what was the other?
Dust mite.
And the dust mite.
Find out, it's easy.
So, all right, we're going to go to this. Tree nut allergies are one of the most common food allergies. One SDSU student found out she was allergic to almonds the hard way.
I grew up in Iowa on a farm, and I was surrounded by cornfields, and I'm actually like super allergic to corn pollen, corn mold, corn dust, and pretty much everything environmental and green. And so my mom had me get allergy tested because I was having asthma attacks, and found out that I was allergic to pretty much everything green. And my 6th grade year, the fall, I found out I was allergic to almonds. I was at a softball game, and my lips swelled up really bad, and then my throat started to swell up pretty bad, and so I was rushed to the ER and had EpiPen and all that stuff gone. When it's environmental, my eyes just start to water, and I sneeze, and itchy, runny nose and stuff like that. But when it's almond allergy, I can kind of feel tingling in my throat and then tingling in my lips, and my lips are usually the first to start to swell, and then it goes into my throat and then my tongue, and it's just like a tingly, like tight sensation, I guess. And so that's when I know that that's coming on and I need to do something about it. There's 2 experiences. One would have to be like an environmental one, and I was off my allergy meds to get tested for allergies. You have to be off all kinds of medicine for 3 days. And so it was on the 3rd night, and I completely broke out in welts and huge hives, and it was terrible. And my mom put ice on my back and stuff to try and like calm that, but I had already gone the 3 days, so I wasn't gonna like start all over and take my allergy medicine. Then there was another time where I had almonds on accident. It was in like this soccer banquet, and I ate almonds, and my throat started to close up a little bit, and I had to have an EpiPen in my leg. And then after you have your EpiPen, you have to go to the hospital because it's so much adrenaline. So those were probably by far the 2 worst episodes that I've had. I'm not too fearful, I guess, of it. I just make sure I know what I'm eating before I eat it, and just being really aware has definitely kind of helped that whole fear situation. But when I do feel one coming on, it kind of is an anxiety attack, and like, oh my gosh, and I need to do something about it now and get that taken care of now. And so that, when I feel one coming on, it definitely is a scary thing, but it's not something I fear on a day-to-day basis. I've only ever used one and then gone straight to the hospital when I've had to use an EpiPen. Someone else did it for me, so I didn't have to do it because I don't think I'd be able to give it to myself. It's a thicker needle, like to penetrate your jeans or whatever you're wearing. left a pretty good welt when I did have to use it.
Welcome back to On Call with the Prairie Doc. 1-888-376-6225. Give us your calls. So this is a woman who is allergic to tree nuts, yes or no?
Well, you just opened a can of worms, which we were discussing, and we loved it. Almonds are really the pit of a fruit, so they're really not officially a tree nut.
Oh.
Tree nuts are like, they're like pistachios and
almonds, walnuts,
cashews, that kind of thing.
Yeah.
Okay.
And what about peanuts?
Peanuts aren't a nut.
Not a nut either.
No, they're a legume. So you've brought up legumes, peanut, tree nuts, pistachios, cashews, Brazil nuts, that kind of thing, and almonds, which are in a separate category.
But oftentimes the almonds seem to cross-react with the tree nuts.
Perfect.
Oh, is that right?
It's a cross-reactivity, but it's not actually in the same. So that's what makes allergy very interesting, is there's things that cross and don't cross.
I don't think there's another fruit pit that we eat, though, regularly. I mean, you know, I haven't heard that one. I've never heard that one. That's a good one.
We used to have that cancer drug that we took out of the pits of...
apricots.
Apricot. What was the name of that?
Apricot pits.
Yeah,
whatever
exactly.
they were. I don't know why. It didn't
remember.
work.
No, but you went to Mexico to get it because they thought it cured cancer.
Apricot pit. That's the only other pit that I know of. It's just the pits. That's what it is.
Yeah, exactly.
So the question about this is we're talking food allergy, right? Food allergies. And of course, the message on peanuts is that it can be very, very almost kill you if you don't,
Well,
if you ingest it.
Right, in the newest literature, you know, they brought up this literature and said, well, you should expose your kids to it earlier because they won't get it. Now,
is that true?
Well, it showed it. Well, you go ahead. You went to the...
Yeah, actually, the trend is that if you get your foods exposed to your skin, you're more likely to become sensitized and perhaps become allergic to it, whereas your GI tract is set up to tolerate things because you need nutrition. And so your body knows that it better tolerate this.
So have the kid not smear it all over his face and get it in his mouth.
Actually, in our homes, if you go around and you do some sampling of the dust in your home, most everybody's house has got tree nuts, peanuts, egg, all that stuff in fine dust amounts.
Oh, really?
And as you're rolling around the floor, crawling, having a fun time, it's all over your skin. And you think of the atopic dermatitis, eczema kids, their skin is broken down, there's little cracks, and they get better exposure than those of us that don't have it.
And it's why they're positive to egg a lot of the time, because that's one of the dominant aerosolized proteins. And so it's just... and then there's almost no allergy to peanuts when they're boiled.
Oh. Mm-hmm.
But if they're roasted, then that's antigenic.
Well, and I want you to know, having lived in Atlanta and married a Floridian girl, we love boiled peanuts at our house. We've got questions. How soon after I eat something will I show symptoms of an allergic reaction?
Anywhere from under a minute to up to 45 minutes, and sometimes 2 hours, but that's rare.
I would say less than 2 hours.
Okay, and if you haven't hit by 2 hours, you're probably okay.
In this part of the world, you're pretty safe saying that. There's the alpha-gal allergy where you eat beef and 8 hours or so later you'll have a reaction, but that's rare here.
Okay. Caller asks about allergic to shrimp and crab. Can I eat clams, mussels, scallops?
Well, the answer is yes, they can. They're not related groups, unless you happen to be allergic to clams, and then that would be a problem.
All right,
so
the answer is no, not in general. What about strawberries or other fruits I'm likely to be allergic to?
Well, strawberries actually have a histamine-releasing substance in them. That means I contain something that can release histamine from mast cells independent of allergy.
Even if you're not allergic, you might have an allergic reaction.
You might have a reaction, usually not a full-blown anaphylactic reaction. Right. Strawberries have much more of a local reaction.
So it's like smearing kids on their face and they'll get hivey-looking things, but
the
they'll eat
strawberries.
it and they won't react. And as the kid gets older, that generally goes away. You need a lot bigger dose then.
So the prompter said there are 8 common foods that people are allergic to. What is that list? Of course, milk,
Egg,
and
soy,
eggs, and peanuts,
tree nut,
Fish,
fish,
shellfish.
shellfish is a
crustaceans, shrimp,
Right.
crab. Who did we miss?
Did we say wheat?
wheat.
And we said milk, egg, wheat, soy. Yep.
Okay, soy.
Soy.
Oh,
1, 2, 3, 4, 5, 6, 7, 8. You need one more.
well, I need one more. We stumped the allergist.
Okay.
We have 21-year-old man from Custer. The top of my hands break out like in little bumps after contact with cattle, especially during the spring. As a rancher, I can't avoid cattle, so what can I do to reduce the breakouts as I prevent them altogether if I can continue to, or if I continue to have contact with cattle, will these breakouts get worse? That's interesting.
That's again, there's an IgE-mediated allergy, and that can be a contact allergy, and that can be a problem. You can also have what's called a contact dermatitis from it, which is called allergic contact dermatitis, but it's not mediated through an allergic mechanism.
Right.
So if the bottom line for both of them is to wear some type of barrier.
Like CeraVe, for example, or zinc oxide.
Gloves in a bottle.
Gloves.
And gloves. Gloves in a bottle is a chemical. It's
Gloves in a bottle.
Right. It's
That's
a glove in a
interesting.
bottle, and then you smear it on, then you put on regular gloves.
Oh, wow. All right, and that's good recommendation for him. 43-year-old woman from Brookings, are psoriasis and allergies linked? Mark?
Nope.
Not
It's
related.
a different disease.
Different story.
Totally different part of your
Immune system, though, right?
Right.
But it's completely different than the allergic part.
Right. One's IgE, one's through a different system.
Okay. How does stress affect allergies?
Well, like stress always does, the tolerating of that allergy is not as good when you're stressed.
You know, this man talked about working with cattle, and it kind of got better as the summer goes on. I in the spring, when the gnats first start biting, I have tremendous hive-like reactions, and then go away. Not even, I think it's not that the gnats go away. I think I get used to it. Same with mosquitoes.
Because you're getting desensitized, but not tolerant, because the next year it shows up again.
Right. Same story with, is that what desensitization shots are all about?
Well, that's the starting of them. We can desensitize people pretty easily. The next phase is to make it more permanent. That's tolerance, and that's the real nitty-gritty of what we do. That's what takes the extra time. Because I can desensitize somebody in probably a year easily, and probably even less than that, but I can't have them have tolerance probably for 3 to 4 to 5 years.
But you have ways to do that. That takes the real allergist, right? What way would that be, Mark?
Well, the allergy shots are probably the big thing that's done, and we know that you need to go at least 3 years
On
with the
allergy
shots. If you go a year, year and a half, 2 years, and stop, almost everybody relapses. You get out past 3 years, and a lower and lower number that will relapse on you. We now have some new things under the tongue, sublingual immunotherapy. You're going to have to do it for the full 3 years, or else it's all just going to relapse, and it's not a lot better than taking Claritin.
But if you do it 3 years, what's my chances of not having allergies again after that?
It should be about 60 to 70% of people stay just like they are when you look out a decade. You go 5 years, it'll be a better percent.
So that's good. So you want to stay. Now there's a lot of cost with shots, and people have talked about the shots being, you allergists, that's your bread and butter. That's where.
But it's been studied. I mean, they did a huge Medicaid study in Florida.
Okay.
And they
this was like a year ago, right?
Probably 5 now.
5 now, because it takes so long to do it, but it was a huge number. And it was clear. you spend a lot more money on medication. Remember, your allergy is usually bigger than your medication, so you're having all the problems with grades as a kid and not sleeping well and all those kinds of things.
Sinus infections, asthma flare-ups, going to the ER.
Those were all put on the ledger for people who weren't on immunotherapy, and they compared it against the ones on immunotherapy. No comparison in cost. It was more than double. It saved money.
Before a year, you're $1,000 cheaper to go on shots.
In less than a year.
Yeah.
So Medicaid, who doesn't have a lot of money, I mean, that's the same way in South Dakota. We're really struggling with the Medicare dollar. You would save money if you encourage them to go to the allergist.
The system.
Yeah, us the taxpayer.
Okay. Here's the 8 foods that are most common. Milk, eggs, wheat, soy, fish, seafood, peanuts, and tree nuts. We said all those things. That's it. Good. You guys had it. I'm sure we said all of it. What did we not say?
We did. We said them all.
We said them all. Yeah. What causes brain allergies, and what are the symptoms? And what, I lost the question there. So you should
have lost that question.
What are the brain allergies? You have any idea?
Well, I don't know exactly what they're describing. I do have people who come in who describe a brain fog. And again, they're usually on other medications. I mean, it does. And allergic disease does, over time, it disturb your sleep. And so that's going to cause an issue. And, it's a physiologic response. But I don't know exactly what they're talking about, brain allergy.
There was the clinical ecology movement years ago that talked about that, and that's fallen out of favor and been disproven.
Yeah, okay. Woman from Brookings, will a steroid nasal spray affect glaucoma? If you're a steroid responder, should you use a nose spray like that?
It's in the PI.
Explain
the information.
Product insert.
It says that there is some risk of glaucoma. I can tell you, as a steroid eye drop person, it did raise my pressure somewhat when I was on them, and we watched them. I think it needs to be monitored. I don't think it works on everybody. It can cause some problems.
Nasal steroids are extremely rare to cause that.
Because of the dose.
All right. So the point is, you're a heck of a lot better.
But if you have glaucoma, you'll get
monitor
checked.
You got to monitor
more
your pressures,
susceptible.
and you may have to take something to lower your pressure.
All right. 53-year-old woman from Brandon. When I take nasal quart for seasonal outdoor allergies, am I doing it wrong if I can taste it in my throat?
No.
That's perfect.
That means that it's working.
So how do you spray?
That means your nose is working.
I've heard people you spray into the septum. I've heard people you spray not to the
septum.
So how do you do it?
Inside of the nostril to the inside of the eyeball on the same side.
Oh, to the inside of the eyeball.
Right, and remember to look at your toes when you spray your nose.
So squirt, 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 squirt.
Oh, you want to be down.
Well, if you go up here, it just goes up and comes down because your nose goes back.
Right.
The roof of your mouth is the floor of your nose.
Right. So, yes. So, but you'd say, look at your toes, spray up your nose, and spray toward your eyeball on the same side.
Yep, inside the eyeball.
Take it off of the septum or the middle part.
And if you want that taste in the back of the throat faster, sniff.
And so
a lot of times just holding your breath works better.
Show me what you're talking about.
Oh, let's see. Do we have one where it's the front of the, looking at the front of the face?
We do.
There we go. So what we're trying to do is spray the outer walls here. That's the part that swells up with your allergy. And so your aim needs to be so it hits that.
Okay. So it's the outer walls, not the septum. There's some problems with septum breaking down if you hit the septum.
Well, it bleeds.
Oh, it bleeds.
Right.
Right. So go out, not toward the septum.
Yep. Right.
Female, should I consider moving to decrease my allergy symptoms, or will it likely not help considerably? I mean, people want to move. I mean, go to Arizona, right? Used to be the thing. Now we know Arizona's worse.
Top of a mountain. That's good.
Antarctica.
Antarctica.
Cruise director. Although that still gets you dust mite and probably animal, and definitely doesn't help you with food on a cruise.
Top of the mountain because?
There's a lot less antigen at the top of a mountain.
Okay. All right. So, in other words,
the answer is no.
Don't move. It's everywhere. It's everywhere.
Right. You just trade
one allergy to another allergy.
It just takes a year or two, and your allergic system seems to recognize that area's trees or the weeds, and you become allergic to those.
So you did a skin test on me when I was an audience member of the med students, or I mean, our medical doctors in Brookings maybe 15 years ago. And I mean, I just blew up on dog, on cat, a little bit on dog, certainly on, actually it was mites. Oh, dust mites.
Dust mites.
Okay, to kill dust mites, right? So later, I did it again on dog, and it didn't, or cat, and it wasn't as bad. I mean, it changed.
But it was still positive.
Yeah.
And you know, there's a certain size that we use, and we look at the negative and the positive controls. And what you have to do with all these tests, whether it's the blood allergy test or it's the skin test, talking with the patient, hearing the symptoms when you have exposure, that's what's so key.
Is the history. Yeah. A 45-year-old woman from Volga, can the public self-refer to an allergist, or must they go through their primary care provider? They can go directly to you if they want to, can't they?
Yes.
That's how our office is.
Yeah. But it'd be nice to talk to your primary care doctor.
We always want primary care.
And I'd like to get notes back to the primary care doctor, and sometimes a person's insurance needs certain routing.
Right.
And so always be careful with that.
Certainly Medicaid, it requires the primary provider.
Some of the TRICARES and,
Yeah. 79-year-old woman from Sioux Falls, can you develop an allergy to a pet that is now 13 years old? I have had it since it was a kitten, but now I have sinus problems and runny nose, and I think it's due to the cat.
That's well worth testing to see. It would be very unusual at her age and with regular exposure to develop an allergy.
So,
it's much more likely rhinitis that's vasomotor rather than allergic.
or an infection.
Infection's good. Yeah.
What about vasomotor? I mean, how is that different than an allergic reaction?
It's neurologically driven, and it's seen in older people. And this is the person like me who eats chili, and then I got to blow my nose 5 times because it stimulates my nose to have a clear, thin, drippy nose, and it's gotten worse as I've aged.
Yeah. What do you do for that vasomotor?
Blow my nose a lot, but otherwise it's ipratropium bromide, which is a prescription nasal spray, which will stop it for a social event or something like that, but it comes right back.
But a lot of, I think it's about 50% of people, an antihistamine makes a difference, and about 80% a nasal steroid will calm things down.
And you can talk to your doctor and say ipratropium, which is a muscarinic, or how do you?
Atropine.
Atropine.
Yeah, or an anticholinergic.
Anticholinergic atropine-like drug. We're coming close. Discuss acupuncture for allergic treatment, yes or no?
There are 2 studies. It's hard to tell placebo versus is it real.
In other words, if it makes a difference.
Studies showed some mild help.
So mild help. You say yay or nay?
I've just not, in my experience, I read the same studies and I was like really underwhelmed by its effectiveness.
I think the more studies need to be done.
Okay, steroid eye drops. What do you suggest for really itchy eyes? Somebody gave them steroid eye drops, as they say.
Oh, steroid eye drops definitely work. They won't take the itch out as well as antihistamine eye drops.
Which you can get also over the counter?
Well, but they're not, yes you can, and they're not as effective as the prescription ones.
If your eyes have that bad allergy, you're probably a great candidate to be thinking about immunotherapy, becoming less allergic.
Right, okay. 10 seconds each. Final word.
Well, I think that you really need to, if your allergy gets bigger than the 2 over-the-counter medications, then you need to be evaluated.
Mark.
There are great treatments for allergy. Don't sit there and suffer. It'd be my suggestion.
There you go. Thanks. We'll be right back after this.
Ready to quit? Great! We're ready to help. Call the Quit line to set up a quit date. Takes about 15 minutes. Next time we talk, we'll review free medications, triggers, coping, withdrawal. Takes about 30 minutes. Check in for 2 more support calls and we'll go over challenges, how to handle slips, And don't worry, if you're stressed or things get rough, just call. Then, bam, you're tobacco-free. So take a deep breath. You can do this.
Spring is the time of the year when people come into the clinic because of a plugged proboscis, a stuffy schnozzle, a nasty nose. An obstructed nasal airway becomes particularly troublesome when we're trying to sleep, and nasal passageways deny us enough air to achieve that forget-about-it-all state in order to drift off into dreamland. Luckily, even with a totally plugged upper airway, adults can open their mouths, allow breathing to come in an alternate way, which is an option not available to infants, I should add, but that's another story. A seasonal allergic cause for stuffy nose happens when prairie winds blow pollen into our homes and sleeping spaces from trees in spring, grasses in summer, or weeds in early autumn. Symptoms of such an allergy include itchy and watery eyes, sneezing, congestion, runny nose, and wheezing that generally lasts for more than 2 weeks. This is in contrast to a stuffy nose from a viral infection or a cold, which starts with a sore throat, full body aches for 1 or 2 days, followed by nasal passage swelling and a dry hacking cough that can last for 1 or 2 weeks. So what are we to do about a stuffy nose? I suggest only blowing the nose gently, since forceful blowing can and will cause painful packed sinuses. Hot liquids like lemon honey tea can be helpful. Almost all the drugs we used to prescribe for allergies are now available over the counter. Long-acting, non-sedating antihistamine tablets or nasal spray steroids and antihistamines can help for both causes, but are particularly helpful when the cause is allergic. These are gentle medicines, and they take a while to kick in, so you have to be patient. My favorite advice is for continuous stimulation of the most powerful nose and throat clearing substance, saliva. This is best done by stimulating salivary glands with lemon or cough drops. Some warnings: short-acting and sedating antihistamines like Benadryl are no more effective than the long-acting type. The decongestants like Sudafed can cause people to become jittery, agitated, and even irritate the heart. So use them very judiciously. Decongestant nasal sprays like Afrin can cause dependency and should not be used more than twice a week. And remember, whether a viral infection or an allergy is causing the stuffy nose, antibiotics rarely will help and can be harmful. So when your noble nose becomes a shut-down schnozzle, there are methods you might use to bring you safe relief. Well, this brings us to the end of our show this evening. It went by like that. I sincerely thank our great guests tonight, Dr. Mark Bubak of Dakota Allergy and Asthma and Dr. Tom Luzier of Aberdeen Asthma and Allergy. The message for you to take home tonight is that while allergies are nothing to sneeze at, there are many treatments and lifestyle adjustments you can take that will minimize their impact on your daily life. From all of us here at On Call with the Prairie Doc, until next time, stay healthy out there, people.
We all experience stress in our lives. Usually it passes and we move on. But when those stresses build on one another, causing a helpless feeling and problems seem insurmountable, you may be suffering from burnout. Stress and burnout. Next time on Call with the Prairie Doc.
Hello and welcome to On Call After Hours, where we answer the questions we weren't able to get to during the broadcast portion of our show. All of your questions are important to us, and we want to answer as many as we can for you. So let's bomb through it, kind of alternate, and we'll go for this. Are dissolvable pills as effective for seasonal allergies?
Well, if they're dissolvable antigen pills like Raguatec and the Graztec, they're not as effective as allergy shots, but they do give you desensitization or some immunity against ragweed and grass. So they are effective, and we will use them.
I think the other thing would be like the Claritin Ready tabs,
Yes.
or those melt in your mouth. Antihistamines will work as well as the liquid or the pills. It's just a different route to be taken.
Okay. She said, son doesn't swallow the pills for seasonal allergies. I don't feel the same benefits. Can a person use the same pill type for seasonal allergies for years with the same effectiveness, or does it decrease in effectiveness?
When you decrease effectiveness, it usually means your allergy is getting bigger than your medicine.
And you need to come in and see the allergist.
Or add nasal steroid, which is what we've been kind of harping on here.
Okay. How can I tell if my child has allergies or just a common cold? Mark?
Again, that's the itchy, sneezy, lots of sneezes, not just one or two. They're the 10 sneezes in a row. They're itchy. They get the red eyes. That's both sides.
Somebody said nasal mucosa turns white. I've not ever been able to see that.
That's hard, and I think season's probably bigger. The trees, such, it's more like 4 weeks. The grass, it's 3, 4, might be 2, 3 months. The weeds are 2 months, and so that's a lot longer than an infection.
Right. Sure, timing's important too. You get infections in the winter, and you get seasonal allergy in the spring, summer, and fall.
Right, and a hacky cough is commonly the cold that follows a sore throat and a low fever for a day or two.
Sure.
But don't forget that a lot of the people have an underlying allergy. Say the dust mites are there, and those people catch an extra 2 or 3 colds a year because of the allergy.
Oh, so the allergy sets you up for the
Yep.
back. So you have both. So unfortunately, that's the complicated answer. How can I tell if my child has allergies or just a common cold? Okay, 63-year-old man from Rapid City. For 3 weeks, I've had welts. I've been taking Benadryl that relieves the symptoms, but the welts come back soon after. I have not switched medications or soaps. Do the doctors have any idea what could be causing these welts, and am I treating it correctly?
Well, urticaria is usually, if that is in fact what's going on, since there's a lot of things in the skin, but we'll assume it's hives or welts. And again, when it's under 6 weeks, it's an acute urticaria, as to be contrasted from a chronic. They're really from 2 different varieties, but they usually are an upregulation of your immune system, which means treat it symptomatically. Benadryl is probably not the best choice. I prefer cetirizine, the Zyrtec equivalent, and I prefer using a double dose. That's 10 milligrams in the morning, 10 milligrams at night. If they have a lot of swelling with it, which is called angioedema, I do use Zyrtec, which happens to be a type of antihistamine, 150 milligrams twice a day. So, and I hang in there with the patient for all the way until that 6 weeks, because usually whatever's the underlying issue goes away, a virus or something like that. But something as simple as a bad tooth or a bacteria in the stomach, that will keep going because that problem's still there.
That was well done. I thought that covered it. 82-year-old woman from Brookings, ends of hair causes ears to break out. Why is this? Is there an allergy? Happens 1 to 2 times a spring for the last 15 years. Mark, what's that?
People don't get an allergy to their own hair. So that if there's an allergy, there would be some product in the hair, or that you're having, say, a hive condition, and it's irritating, brushing along with it.
But I would say something in the hair products she's using, the hairspray or the color or something like that. 60, what do you recommend that she do? Topical steroids to the ears?
I think you have to see what's going on.
Go in and get seen.
Have
somebody look at it.
You've got cell phones, so take a picture of it when it's symptomatic, because that does help. Because a lot of times you come into the doctor and they're not there.
Here's a picture of it when it was bad.
Yeah, exactly.
67-year-old from Sioux Falls. When I come in contact with evergreens, primarily, I get a rash over my arms and legs. What can I do to prevent this? Any contact can provoke can provoke a breakout. Evergreen allergy, I've not heard of that.
It's the resin that's in the evergreen, usually.
It's
and
real common.
It's very
really?
common, particularly in places where evergreens are common, and the treatment obviously is to avoid contact with the
Long
evergreens.
sleeves.
Yeah. So probably taking saunas and using cedar switches is not a good idea
For those folks.
for those from Yulee, or no, what is the name of northern Minnesota where they do those?
Ely.
Ely, yeah, Ely. 80-year-old woman from Sioux Falls, can you be allergic to
Yes.
kiwi? Kiwi.
Yes,
Had it once on a salad and got very sick immediately and throat swelling.
yes,
Should she have an EpiPen nearby?
possibly yes.
Yep.
The answer is yes. 75-year-old, anything else she should do?
Well, kiwi has some cross-reactivity, so
With
it's worth
strawberries?
mostly with things like latex, banana, avocado. She should be evaluated. With her age and having to be an EpiPen, she should be evaluated.
80 years of age.
Yeah.
75-year-old woman from Rapid, can you talk about peanut allergy more? Why does walnuts burn her mouth? She has celiac and many allergies. Walnuts burning the mouth. Haven't heard that.
There is, I mean, walnuts, you can have an immune response to them, tree nuts in general, and it can be allergic, it can be immunologic, so that's another one that should be evaluated.
Okay. Anything more about peanuts that we didn't cover? Mark, any comment about?
I think that, one of the exciting things that people ask about is becoming less allergic to peanuts, because there's studies underway. I have to say that we're not ready for people to be clinically getting less allergic with those desensitization protocols yet.
Because there's danger there.
And they're not as successful as we wish they were, and there's a lot more reactions from them. But boy, the fact that we're actually helping some folks in these studies is really optimistic in my mind. It's exciting. So we'll just have to wait and have a lot more of these research things get done.
Okay. 71-year-old from Yankton, caller, gets painful rashes and swelling from gnat bites. Usually puts rubbing alcohol on the rashes and it relieves it. Is there anything else I can do about this? I would say don't put rubbing alcohol on it. It's the worst thing for dry skin, and the majority of the time that just makes rashes worse. I would use...
I use unscented Sarna, which is hydroxyzine topically.
Oh, that's interesting. I'm into CeraVe right now because my dermatologist guest. CeraVe is a kind of a protector, kind of a barrier. It has ceramide in it. Those are really good. But you like topical
Sarna.
And is it over the counter?
Yes. And there's one with fragrance and one without. You want the without.
Okay.
Basically,
How do you
the
spell
gnats.
Sarna. And you've described your experience with gnats and mosquitoes, and this is a bit of that experience.
Okay.
The gnats spit into you and it releases the histamine. It's not an allergic reaction, it's just your body doing what it's supposed to do when the gnat spits
being
in
attacked.
you.
Yeah, when the gnats attack. Comment from 80, well, I get that way when people spit on me all the time. I mean, that's my
Yeah, you
reaction.
get pretty itchy.
Yeah. 82-year-old woman from Sioux Falls, the drug that docs were trying to come up with from Mexico is Laetrile.
Good, good.
Thank
Bravo. Thank you.
63-year-old woman from Lenox, rash over 90% of her body for 2 to 4 years. It keeps getting worse. What should she do?
Go to the dermatologist that's appropriate and get a biopsy.
Yeah, biopsy is important. Blood tests.
And actually, there's an important part to it that dermatologist has a good histopathologist that takes care of that. That's very important.
Right. You've got to have and if that allergist and that dermatologist isn't finding it, find another dermatologist, I would say. Get another second opinion.
Yep.
Well, that's it. Thank you for joining us on our website. We appreciate all your questions and the opportunity to answer them. And thank you again, gentlemen, for providing these great answers.
Thaning you for having
Would
us.
love being here.
Funding for On Call with the Prairie Doc is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
Larson Manufacturing is proud to support On Call Television as it continues to open doors for important medical information. and by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota. Additional funding is provided by Aberdeen Asthma and Allergy, Brookings Health System, Dr. Mark Bubak with Dakota Allergy and Asthma, Dakota Care, Dakota Dermatology, the Orthopedic Institute, Physicians Care Sanford Clinic Community Service Committee, and Swiftel Communications. Closed captioning for On Call with the Prairie Doc is provided by the generous support of Avera, Brookings Health System, and Fishback Financial Corporation.